Hi, and welcome to another episode of Real Chiropractic Stories. I'm your host, Dr. Gregg Gerstin, and what we're doing here is we're developing a library of chiropractic stories told by the individuals who experienced it and how it changed their lives. If you or someone you know has experienced chiropractic and it's changed their lives, have them connect with me. Let's tell your story, because more people need to hear these stories about how chiropractic is essential to not only helping your life, but keeping you healthy, active, vital for the rest of your lives. Now, if you like these stories, go ahead and subscribe on any of your podcasts at Real Chiropractic Story. You can find it. You can also check them out here on my page. Additionally, if you like the stories, give them a thumbs up on our podcast. Give it a 5-star review and make sure you share it with the people who need to hear it. Now, I'll be honest with you. Today is going to be a little bit different than most of our interviews because I don't know this story and this conversation that we're going to be having. However, this person has been referred to me by several people, and they've told me that the story is amazing. So I'm going to look to introduce you to, in just a minute, a friend and a colleague of mine, Dr. Joe Labriola, and he's going to tell us his story, and we're going to talk about health and wellness. He practices in Ramsey, New Jersey with his wife, Pilar, and they've been changing the lives of thousands in their community. So you're in for an absolute treat. Without any further ado, let's look to dive in, and I want to introduce you to Dr. Joe.
Hello, everybody. How are you? So thanks for having me, Doc. I appreciate you taking the time today.
Well, thank you so much for coming and joining us. I really appreciate it.
My
pleasure. Would you be able to share with our guests a little bit more about you so they know who we're talking with?
Yeah. So as you mentioned earlier, I practice in Ramsey, New Jersey. We're in about 20 minutes northwest of New York City. Dr. Pilar and myself have been practicing there for about 12 plus years now. I also had 8 years prior experience, so I'm in this about 20 years plus. And we have a son, a 1-year-old. He's actually 1 today. So yeah, very interesting year it's been. It's been awesome. So it's been really great. But yeah, we've been helping lots and lots of people, and it's really exciting.
What's your son's name again?
Nicholas.
Oh.
Great little guy. So smart. He's so awesome. So changed my life completely. I love it. It's awesome.
What do you guys have planned for his special first birthday?
Well, it's funny because at the time that you're watching this, we're in a pretty heavy quarantine. So we have a Zoom meeting prepared for later that we're all going to join in and sing happy birthday with the family members from across the country. So it's going to be pretty fun.
That will be a lot of fun. You may need to share that with us here.
It'll be pretty cool. It's not the way we originally planned it, but you know what? You got to punt sometimes, right? So that's
right. You got to play through, right?
That's exactly right.
You totally do. Well, without further ado, what was your life like before you got introduced to chiropractic?
So yeah, it kind of leads back to the beginning of my story, which is pretty interesting. So when I was 5 years old, I was diagnosed with a pretty heavy duty breathing condition. And it was one of those things that I'd be in the hospital for stretches of 4 or 5 days, then out, and 4 or 5 days in, and just trying to figure out what exactly was going on and what the triggers were took a lot of work. So after the first initial round of hospitalizations when I was a young kid, they determined that I was allergic to dogs. So the problem was that we had a black lab, and so out the door went the black lab, and I immediately became the least popular person in my family, as you can probably imagine. But that, unfortunately, that didn't solve the problem. So I would continue to have issues. Sometimes they would put me in the hospital for a little stretch, but most of the time it was go to the emergency room, get the treatments that I need for breathing, and then come home, and who knows when the next one was happening. So that was pretty consistent throughout the beginning of my life. And it was, it's funny because when you're a young kid, you deal with things as emotionally as you can. It's first terrifying, and then it's just like, okay, I guess this is what we have to do today to get through the day. So we're just going to, finish up the day by going to the hospital. And it was really common.
So that sounds as though you were pretty hopeless.
Yeah. So what was, as this went on, we're looking at different factors that might be involved. So, there we did the big allergy test, where they did the scratch tests and everything. And we figured, well, it's got to be something in the environment, and it's grasses and pollens and molds and trees. And, I was coming up allergic to all of them. But I can't move because my parents live here. This is what we're doing. So
there aren't many places where you can get rid of grass.
That's right. I mean, you're going to be allergic to something. So this was, it was notable that it would happen at certain times a year, would be more consistent. But it was just one of those things that for me, it wasn't just allergies. All of a sudden I would get like the tightening of the chest. And then sometimes it would be bad enough that here I go, right? It's got to be an emergency room trip. So it was very, very, very frequent, unfortunately.
Wow. And how long did those oscillating and multiple trips to the emergency room go on for you?
Oh man. So that was, I mean, realistically, that was about 12 years of time. Yeah. So, you start looking at what else you can attribute to it. So then it became, well, maybe it's a food allergy. So I ended up going for allergy shots, and I did. They found out that it was chocolate and corn and tomatoes and a few other things. And so said, let's do allergy shots. And I went for allergy shots, and I got stuck in the arm every week, and nothing happened. I've had patients that it has been absolutely amazing for. For me, I didn't get any results, unfortunately.
So you tried shots, you episodically managed it with emergency room visits.
Yep.
You probably changed everything in your house 15 different times.
Yep, absolutely.
And it still kept coming back.
Yeah, it was one of those things that there weren't any, typically what happens with this kind of stuff is that there will be layers. So you might be able to get through with one thing and be okay, but the second one comes onto the layer, now all of a sudden everything just happens. And so it would be varying degrees of, well, sometimes the first layer was really low, but then a second layer would come in and it was piling on top of everything. So it was a matter of trying to control. I mean, it felt like, over the years, you feel like it's like whack-a-mole after a while. You're just trying to figure out, well, if I plug this leak over here, is it going to come higher over here? That was what a lot of life was like for me.
Gotcha. So they were looking at all of the external things to try to figure out how do you wind up putting together or piecing together a reasonably realistic life?
Well, it wasn't, for a good amount of time. I mean, like, let's face it, I wasn't picked first for sports for a lot of years. I wasn't sleeping over at kids' houses if they had a dog, for example. So, it actually led to some pretty rough days, self-doubt and things like that, and self-esteem issues, and, all things that just, you look at it from the perspective now of what was going on. But boy, it wasn't fun during those times. You start feeling like you're losing some of your childhood, and by the time that a lot of this stuff had happened, when it happens so many times, like after a while, you just suffer in silence because you're like, geez, I don't want to bring my parents to the emergency room again. I don't want to have to go and deal with all these treatments again. So you just kind of say, well, I'm going to hopefully suck it up and make it through the rest of the night. And, you don't need to do that when you're 13 or 14 years old. That's for sure.
You really don't need to carry that on your shoulders. That is so much. So how or what was the trigger that caused for the first breakthrough, or the first, time to bend the tide, I'll call it?
Well, so I was working at a local farm stand when I was 17, and I was standing behind the register. I'm handing the customer her cash, and all of a sudden I felt the worst asthma attack I'd ever had in my life. Now, keep in mind, by this time I've had 12 years of them, so I know exactly what an asthma attack feels like.
And is that what they were calling it? Were they calling it asthma?
Well, it depended on who was the diagnostician, right? So some of them would say, well, it was asthma, and some of them would say it was a hyperactive respiratory airway. So that's why I just kind of lump it into a breathing condition, because it's like, okay, call it whatever you want. All I know is that I couldn't breathe. So in this particular instance, what happened was I felt like somebody cinched a belt around the bottom of my lungs and another one around the top of my throat. So I literally couldn't get any air in and I couldn't get any air out. Now, if I told you right now, listen, Greg, hold your breath for 30 seconds, you could do it because you know it's going to end, right?
Yeah.
That's how long this lasted without me knowing if it was going to stop. And then finally it released, whatever the heck it was. And then 5 minutes later, the whole thing happened again.
Oh
And
my gosh.
and 30 seconds again, and then it released. And then 5 minutes later, it happened again. And it like we're seizing up. And so that took me to the hospital. Not surprising. It took me there for 10 days of sleeping and laying in basically an oxygen tent. And that's all I did was just had this tent over me and breathe in pure oxygen. And
For
they
10
came
days.
in 10 days. Nobody goes to the hospital for 10 days, for that kind of stuff anymore, 10 days they kept me there. And missed my road test, which was a real problem during that time, as you can imagine, as a 17-year-old. Probably the worst part.
Drive. That's the big problem here.
Brutal. So, but now, here it is. I'm under this oxygen tent, and I'm expecting that by the time this is all done, that we're going to have some kind of a nice, tidy, okay, we're all set, see you later. At the end of the 10 days, they said, okay, here's the deal. We don't really know what caused all that.
So even after all of that, they still were unsure, confused, and didn't know what to do.
They didn't have they couldn't put their finger on an answer as to why it happened. So they said, they said, well, what are we going to do? We're going to treat the symptomatic part of it, which you can expect that would be the idea. So the plan was you're going to leave the hospital with 3 inhalers, 2 medications, a nebulizer, and an oxygen tank. And hopefully we don't see any more. Good luck. That was pretty much where we ended up. Now, that was, you think about it as a 17-year-old, this is now my life, right? Or this is what I left the hospital with, my life.
I see 90-year-olds with oxygen tank, not 17-year-olds.
Yeah, I mean, I got to know Jimmy, the oxygen guy, really, really well, unfortunately. It's not one of the people you want to be having conversations with. But yeah, it was, I knew Jimmy really good because he would deliver tanks to my house to, sometimes twice and 3 times a week. So, wow. Yeah, so that was where they left off.
So how long were you on the oxygen for and the nebulizers and inhalers?
That was, so what happened was that as time went on, it was kind of like, all right, listen, I'm going to be going to college next year, so I have to figure out an answer here. You're definitely not going to be the cool kid on campus walking around dragging an oxygen tank behind you. So totally that's not good, right? And then having a nebulizer up in your dorm room, that's even better. So I, you approach things very differently when you're a 5-year-old versus a 17-year-old. At 5, you're just going with the wave. At 17, you're become an active participant, whether you want to or not. So we looked around for different therapies that might have worked. Pulmonologists, respiratory therapists, allergists, trying to get different handles on what the idea would be. And the general consensus was, listen, these medications and the treatments that you're doing, you're probably going to need to be on those for the rest of your life, because we don't know what'll happen if you come off of it. We don't want that to happen. That happened where you were in the hospital for 10 days. So better to stay on that so we don't, create a mushroom cloud. So that, that process took a while to kind of A, come to grips with, but B, find everybody who was trying to, either agree or disagree. I'd say it was probably about 8 months later after that all happened that my mom was walking out of the grocery store and she saw a chiropractor standing there. And he's just standing, he's got brochures, he's handing them out. He just opened a new office in the strip mall there that was in the where the grocery store was. And my mom just, hits the poor guy with my tail of woe that's like this long, I'm sure. And is like, look, can you just, please can you help my kid? It's really all I want to know, He said, well, look, he's got a spine. Let's start adjusting him and see what happens. So I went 3 days a week for 4 weeks. That was my initial plan. And after the 4 weeks was up, I had been able to work myself off of 2 of the inhalers, 2 of the medications, the nebulizer, and the oxygen tank. After
oh my God, wait a second. Repeat that for me one more time.
After 4 weeks, after 4 weeks of getting adjusted, I had been able to get off of 4 of the medications, the nebulizer, and the oxygen tank on a regular basis.
Oh my gosh.
Right.
That's amazing.
Yeah. So it was, I mean, life-changing, you know? So he said, look, let's go. Let's do some more because there's still one left and let's see what happens. So I did another 3 days a week for 4 weeks. And from after that 4-week period, the one that was left became an as needed medication. And that's all I've ever been on since that time. I've never been on a daily medication for any breathing condition. I've never been back to the hospital for anything. I've never gotten another oxygen tank. I mean, that's all I take is an as needed medication, and that's it.
Wow. What were you thinking after those first 8 weeks?
You know, well, it was very interesting because I think what it did was it changed my perspective because, you know, you're in the hospital for, I mean, take the 1 10-day period that I had, but stretch it out over the entire 12 years that I've been going in and out of there. And you start realizing, like, you start thinking about the fact that, well, people are trying to get healthier in the hospital, right? But what you really realize is that they just were not getting sicker, hopefully. They weren't necessarily creating health in the hospital. That's what I first realized after those first 8 weeks was that I wasn't there in the hospital to get healthier. I was just there to stop the symptomatic, whatever it was, so that I could go back out and do life. But during that 8-week period, what I started to really notice was that where health was actually coming from was not all the medication that I was taking, but it was actually my body that was creating a better, healthy environment just without doing anything else other than getting adjusted. And, you know, now as I look back on it even more so, I mean, the ability for my body to be able to change so rapidly after all these years of having all these problems was fascinating. You know, it really opened up a world that I didn't really know. I mean, I didn't know what my life was going to be like. I didn't know if I was going to have a life. I mean, quite honestly, had I kept going on the rate that I was going, I wouldn't be here talking to you. I wouldn't be talking to anybody most likely. I don't know where my path would have been.
Joe, let's make this get real for people right now. How about that? Okay.
All right. Sure.
So what I hear you saying is that what you realized there in the hospital was that the hospital was really managing your diseases and managing your trauma.
Yep.
And it wasn't helping to develop your health, but it was managing the crisis that your body had fallen into.
Yeah. And I mean, I think, you know, listen, you think about a hospital, okay? You think about what they do there and, you know, you're there for crisis management. Let's face it. That's all it is. And you're not intended to be there for a long time. Let's hope not. But what was interesting for me was that it wasn't just the hospitalization that wasn't putting me in a healthier environment. It was the fact that every path I turned was more with the intention of, let's not make the symptoms worse. Let's keep them at this level rather than get them up here where they were. Let's try to keep them down here so they never get up here. And that was the general consensus from wherever I went. So nothing was really giving me the idea that I was going to be healthier as a result of all this stuff. I was just going to manage a lot of it. Mm-hmm. And at 17, that's where they had kind of left it, was we're just going to manage it. And you don't want to be in that position at 17. No way.
So you were really told that, and it doesn't sound as though anyone helped to wind up looking into, how do we make this thing work better? more
Yeah, I
efficient?
mean, I think each of the, when I look at, listen, I don't hate medication. I mean, I can tell you it's saved my life hundreds of times. But I think when I was looking at the process, I realized that the process was, that is always that first option that a lot of the practitioners that I was going to, that was their first option, and sometimes their only option. I mean, I have been in offices when they had said, listen, we don't really think we can do anything else for you. So, okay, well, but that was the option. So it took, like, look how much searching it took, or, if you want to call it like a happy accident that it took to realize that there was a whole other avenue that I could go that really tapped into the potential of what my body could do to be able to make me healthier. And I mean, it was life changing, quite honestly. It was like the fog had lifted.
Now, can you share with me a little bit about maybe how your chiropractor explained it to you and your family, or how you understand it now and would explain it to a family, that you were able, or someone was able to help guide and coach you to empower your body to start healing itself and controlling itself better?
Sure. So the way it was described to me was very simple, is that we have a brain that's trying to power the rest of our body. Okay. If I want to reach out and make a fist, my brain had to send a signal all the way to my fist to be able to clench my hand and do this. Now, if I want to swing at somebody, then my brain has to tell me to do that, tell that arm to do that as well. But that same principle is also going on to all of your organs, all of your muscles, all of your tissues, all of your cells. What you want to have happen is as clear of a path for that impulse to be able to get to every organ. So some of the things you feel, like pain or weakness, and some of them you don't. And the way he put it was like, you don't feel the pain that people have. You're not coming in here for back pain or neck pain or headaches. What you're coming in with is still the fact that the signal to your lungs is somehow not getting all the way through in a proper avenue. So what we want to do is look at the spine to make sure that the alignment of the bones, wherever those nerves are coming from the brain and through the spinal cord and going out to the lungs, we just want to make sure that those bones there are in the best alignment that they could possibly be in, so that you have as easy a transmission as possible. And so, well, that kind of makes sense to me. I don't know. Pretty simple.
I'm with you. It's a really simple explanation of how the body works and how health works.
Yeah,
However, we try to muck it up and make it more complicated most of the time, don't we?
yeah, absolutely. And I think it was, when he put it in terms of what's happening with me, not just in a general perspective, that made it so much easier for me to understand. When he was saying, listen, these are and he had the chart that was where the nerves were going. He said, look, these nerves are going directly to your lungs. I'm going to look at those bones right back here. Let's trace them back. I'm going to look at those and figure out the alignment. And wouldn't you know, the bones that were where those nerves were coming out of, completely out of their normal alignment. I mean, I had scoliosis as a kid, and that turned out to be one of the main triggering factors as to why this was going on.
So for our listeners, if you don't know what a scoliosis is, that's when you look at someone from the front and instead of the spine going straight up and down, it goes to the side and it curves. Now, this is typically something that develops in adolescents between 10 and 15 years of age, and can progress very rapidly and significantly in a very short period of time. That time frame is usually 10 to 15 years of age, and it's really important for all parents to wind up looking at their kids' spines at least once a quarter to once every 6 months. And if you're curious about a exam to understand that you can do at home, feel free to write that down in the messages or email me. I've got a link to a great app that winds up being able to provide you with an at-home screening that you can wind up doing in the privacy of your home regularly.
Yeah, I mean, to me, something that now that I've been dealing with patients for 20 years, that is something that you need to, you really want to, those of you that are out there with adolescent children, you want to be sure that you're watching that very, very closely. Because it's one thing just to have the curvature in the spine that's not supposed to be there, but this truly can have health effects later on, sometimes right at that point, but sometimes it's later on. And we always want to make sure that we keep that to whatever the bare minimum is that's possible.
Mm-hmm. I just had a patient come to our clinic that wound up at 15 being told via a sports physical that he had a scoliosis, but he was cleared to play. Didn't have a physical for another 2 years, and it progressed to a 70-degree curve, which they wound up doing some immediate surgery for. So unfortunately, this child could have been detected and the process could have been slowed. However, it was ignored and it progressed aggressively. Even after the surgery, he's still left with significant shifts or scoliosis that will hope to helpfully manage outside of the fused area. Now, Dr. Joe, back to the what story that you're sharing with. Can you share with us a bit about the areas, maybe even, that you were told that your spine was out that went to the lungs and helped with your breathing?
Yes. So the main area that he was focusing on was right below the base of the neck, basically at the top of the back, right even above your shoulder blades. And there were a group of 4 bones that he was particularly looking at, and 3 of those that he found were significantly misaligned on me. So think about it too, is that it wasn't, in this case, yes, it was the bone misalignment, but the muscles had to accommodate what happened with the bones misaligning. So I was in constant tension up here, never knew why, couldn't figure out why. I was always feeling like somebody was just pressing and pressing and pressing directly into the top of my back. And it never really made sense. Listen, we all have stress, but I think, I'm not really paying attention to that at that point. What it is that my posture had changed significantly enough that the muscles were working to essentially try to pull it back into a normal position. So they had no choice but to be in such a tense position all day long. And that I could never get this to relax. That was one of the main areas that he started looking at. And that was, of course, that's where all the big changes happened for me.
All right, I'll just say right now, I mean, having some young kids, but working with a lot of parents of teenagers, and most of them wind up complaining about upper back pain or shoulder pain or even neck pain, headaches, and migraines.
Yeah.
And parents will typically wind up trying to explain that away to things like backpacks and books. And unfortunately, it winds up coming from a deeper source, typically inside, which is really important to have looked at. And our medical colleagues, pediatricians, and or internal medicine doctors do a great job in looking at these things and evaluating things. But unfortunately, many times they're massively burdened with managing more significant or different health conditions, that this becomes a challenge for them to identify, understand the right places to send their patients to, and then to help them with the guidance that they wind up needing. So making sure that they find a good corrective chiropractor would be a great help for them.
Yeah, I agree with that. And I think if I could just add one thing is that, it's, you want to be able to start off with the best base posture that you could possibly have. All right. And some of us have better than others, of course. And the problem that we see, and I'm sure you see it, Doc, with kids, is that, technology and phones and all these different devices that everybody's using cause us to look down a lot. The problem then is that what you're doing is you're pulling on the exact muscular areas and bones that I had a problem with when I was a kid. So we're seeing, I mean, I'm sure you see it too, we see more lung conditions now than I've seen more in the last 5 or 6 years than I did the previous 14. Well, not surprisingly, unfortunately, those phones and the things that we're using create a posture that is putting way more stress into that exact same area that I had the problems with. And it's part of life, unfortunately, but unfortunately, we really do see that those kids particularly, if they come into this with a not so great posture, it ends up getting exaggerated way worse when they're using devices.
How do you coach your parents and your patients who are parents on how to guide their kids and or themselves on how to use technology so that they don't wind up causing it to exacerbate, or they get their children to actually listen to them? I know that that's a challenging thing that I hear a lot.
That's that may be beyond my scope of practice right there, trying to get kids to listen to parents. But I think what it is that it's recognition firstly. You know, you have to be aware. And I think from the kids that we have dealt with, when they have an awareness of what they do during a day and they see what it's doing to their posture, like we'll take pictures of their posture, their normal posture, and I say, okay, we'll take another picture with them holding their phone in the way that they would normally do. And sometimes I even like show them while they're in the office when they don't know that I'm taking the picture. I say, look, here's what you look like while you're sitting there. Remember the first posture picture that we took, and look at how much worse this one is when you're sitting there. They, as 12 and 13 and 14 and 15-year-olds, will come back and say, wow, I didn't realize how much during a day that my chin sits on my chest or that my head goes way forward. And they have the awareness. So sometimes it's just they need to be aware first. It's easier, you know, the parents are always seeing it. They always see it. They always see it. But until they can visually, the kid can visually see it themselves as to what it's really doing for them, sometimes that's the domino that needs to fall first before they can actually make changes and actually take some responsibility for it.
Are there any tools that you like to use to help show that to your youth patients?
We will use something called Posture Screen. We use something that it's an app that we use on the iPad, and we take a picture of them. And we've done this with backpacks. We've done this with their phones in their hand. But we'll take a picture of them with the device and without, and they could what it will do is also create a measurement of literally specifically how much their body thinks that their head weighs in a normal posture versus what they're doing when they're looking down. And boy, does that show major changes. Sometimes 6 times as much of a difference between normal posture and when their head is going forward.
And what would 6 times the amount of weight in their head wind up potentially doing to someone?
Well, you know, you start looking at what, if the body does not want, if the body wants a 10 to 12 pound head, let's say, if on a daily basis it's getting a 60-pound weight up here, you can imagine what it's going to do to the bones. It's going to start stressing them out more. It could start wearing the discs, the shock absorbers down in between there faster than what it would if your head was in a proper normal position. And, you know, over time, think of the muscular tension that's going to happen with that. Think of the fact that those muscles are working so hard to not be in this position. They have to pull back. They have to pull back. But what do you keep doing? You keep wanting them to go down, and they want to pull back. You end up in this massive struggle. So we're just trying to make sure that there's the best amount of balance between the things that you have to do in a day, but counteract that with things that are in the complete opposite direction, so that your body understands that, yeah, we might go this way, but we also go this way too. We can't only go down.
I love it. So train it to do almost the opposite.
Yep.
I love it.
Absolutely.
No idea where we're heading here, but I love it. You know, as I talk with different doctors and patients throughout this process of this podcast that we've done called Real Chiropractic Stories, sharing stories of how chiropractic has helped change lives, what are some of the key and essential things that you look to teach your patients to help them to stay healthy, active, and vibrant?
Well, I will say this, you know, obviously for us, and for me personally, the benefits that I've seen with chiropractic have been beyond amazing. The adjustment, that if you take the adjustment out of it, because I already know how important that is and the patients know how important the adjustments are, there are generally 3 other factors that I will throw on top of that. And I kind of look at them as a pyramid, is that if we have the adjustment as the base, what else is going to go above that? The first is sleep. You have to sleep properly, not necessarily in the position that's the most comfortable position right off the bat, but your body will learn If you start training, it'll learn how to be comfortable in the proper position, not the weird position that you want to be in. The second thing is exercise. The body needs to keep moving no matter what. We are creatures of that crave motion. No matter what we do, we prefer to be moving. This is why, especially at this time, it's hard for a lot of us to be sitting around, because we need to be out there doing things. The body actually will get stronger just from the fact that you're just even taking a walk down the road. It helps a lot. The third thing is water. This is one that I find is lacking more than any of the other things that we teach people, unfortunately. And we have seen that people just hate drinking water. And okay, I can understand that, but at the same time, your cells need water to keep going. Your cells need water to be as strong as they could possibly be, to help you detox. And you're going to probably see a cat walk across here in about 1 second. There you go. So,
hey, kitty.
You can only keep them down so long,
Uh-huh.
So the water is the one thing that if you're lacking in the other things, the amount of water that you drink can sometimes at least counteract some of the negative that you've done in those directions. So those sleep, exercise, and water are huge. And I don't mention diet because everybody knows I either eat a good diet or a bad diet. So you know what that's all about. But the other three that you can control the most are the sleep, diet, and exercise. Sleep, water, and exercise.
I love it. So on the top of this pyramid, we're going to put water and proper hydration. We're going to then layer it down with movement and exercise. And then after that, we're going to give proper rest. And then at the very bottom, the absolute foundation is the chiropractic adjustment, or making sure that your brain is connected to your body with as easy and as streamlined a force, so that energy can get through to every tissue, organ, and gland in your body, and help your lungs to continue to breathe as you ran into challenges with in your past, and has helped you to not only recover from multiple episodes in a short period of time of hospitalizational respiratory issues, but to not only wind up managing that, but to get you off of all medications, all oxygen, and to have use of one emergency. And how often do you wind up using that?
I mean, that's not frequent. I mean, usually I have to be in a position where I know that there's going to be an issue. So if I'm in, it's that so many different layers have happened at once that it's like, okay, if I just leave the situation, I'll probably be fine. So it's not often.
Awesome. Well, Dr. Joe, I want to thank you for joining me. This story was absolutely amazing, and I'm so glad that your mom stopped at the chiropractor at the grocery store. So many of us have seen chiropractors in places that we probably never thought that we would. But thank goodness they are doing that. Thank goodness they're out there doing screenings, connecting with people, because they changed your entire life trajectory.
Yeah, I mean, it's like I tell patients, like, listen, if I had, if she had run into the chiropractor when I was 5 instead of 17, I mean, who knows what a different life it would have been, but it is what it is. And I'll tell you what, I think it's the fact that I was able to get that experience at that age. I think I appreciate it more. And I became a chiropractor because of it. So that really changed my life so much that here it is, I'm doing it.
I think you were probably destined to be a chiropractor, and your mom and dad and sister or siblings or family have probably passed by that chiropractor and just weren't at the right point to be able to grasp onto it and to make it a part of your life. And thank goodness now they did, because
Yes.
you've wound up over the last 20 years changing so many people's lives, and you've met your wife, you've been able to have an amazing, cute, adorable son who's a year old. For all of our people watching, let's give him some love. And Joe, I like to sort of wrap up our conversations with a couple of questions.
Sure, go ahead.
So the first one I want to ask is, who is your chiropractor?
My wife, Dr. Pilar, is my chiropractor. She is one of the best adjusters I've ever met. and keeps me in line at a minimum of once a week, thank goodness. And that's the base of my health plan anymore, is making sure I'm getting adjusted once a week.
Mhm. Well, she's an absolute rock star. I love her. I love you. I appreciate you joining me here.
My
The
pleasure.
last question I always look to ask is, do you know anyone whose story we need to share as a part of this project?
I actually think her story would be good, but for totally different reasons. And it would be very interesting to hear, now that you've heard this story, hear her story in that perspective, in a totally different avenue, because it's absolutely nothing like my story. But still, here it is. We ended up in the same place, so it's pretty cool to listen to her story too.
So I love this, okay? And you may or may not know this, but one of the references that suggested that I speak with you was actually her. Okay? So now you're going to have some responsibility on helping me coordinate this conversation with her. Can I count on you for that?
I will make sure that she's on as one of your guests.
Awesome. Well, Dr. Joe, I want to thank you so much for joining me on this, sharing your story, sharing some of your insight too. I want to thank our guests and our listeners for joining us as well. We've got some great feedback on our live feed for this. And so you guys know, we'll look to provide a link to, I did a great video of that scoliosis spine screening. So I'll look to put that into the links, as well as Dr. Tpke. I'll look to even direct message you that so that you can have that. If anyone else is interested in that scoliosis screening, feel free to reach out to us. Or if you have more questions about how to manage a respiratory distress like Dr. Joe's story, feel free to reach out to him. I'm sure he'd be welcoming of anyone.
Gladly.
For myself. And for those of you who are out there, if you like this story, give it a thumbs up, give it a 5-star review wherever you listen to podcasts, because more people need to hear these stories. And if you know someone who's had respiratory distress, like Joe, and maybe along the spectrum somewhere, let's not wait 12 years for them to wind up getting introduced to someone who may be able to help change the full trajectory of their life.
Absolutely.
I want to thank you guys all out there for listening, and I want to thank you for letting me be a part of your health.